Let's now talk to the Private Hospitals Association of the Philippines. Joining us live via Zoom is its president, Dr. Jose de Grano. Dr. de Grano, good morning. Thanks for being with us today.
Yes, good morning, Rhea.
Doctor, can you tell us about the vacancy in private hospitals in Metro Manila? Are there still any vacancies?
Well, if you will note the data given by the Department of Health, there's still supposedly vacancies in the National Capital Region because the occupancy level is only supposedly around 66%, which is actually 2% higher than the previous day. But then around 42 facilities are, as you said, are already at the critical level of their occupancy. But remember that this data does not include people waiting at the emergency rooms and also people being transferred from other facilities. And that's where of course, the one hospital command center usually gets in, and then they will have to really look for beds in the National Capital Region or in the surrounding areas where the excess patients or the spillage in these facilities will be brought.
That's right. I want to talk about hospital equipment, supplies like oxygen and ventilators. Are there enough to serve the patients that are there? And if we run out, is there a place to get more?
Well, actually, right now, what they are trying to get right now are the inflow or high flow ventilators, and not the traditional mechanical ventilators. The mech vents that they previously used was for the intubated patients, and they're now trying to shy away from this unless the patients really need the intubation. And our suppliers usually can no longer provide these high flow ventilators, but they said that they are still procuring this from abroad.
Doctor, can you talk to us about the condition of healthcare workers? Obviously, they are at the greatest risk during this time. Can you tell us how many have been infected or are currently in isolation?
Well, actually, there are already reports of healthcare workers being infected, but I do not have the real figure of this. Maybe our different societies and the groups can make that can provide that figure. But usually these are not very serious cases, but still they will have to take a rest for a minimum of 2 weeks, and that will eventually, that will decrease the number of people who will manage our COVID beds. And that's why if it's true that the government can provide augmentation personnel to aid the different facilities, then it will be a welcome respite for our hospitals.
All right, so you have sought more manpower from the government, is that correct?
We are actually waiting for them to give it to us if there are really augmentation personnel. And that's what the Department of Health has been saying. They will try to get probably from military or other agencies and bring this to the hospitals that really need them.
All right, thank you so much for your time this morning, PHAPI President Dr. Jose de Grano.